Hi everyone, I'm Dr. Lisa Jewell with Southway Plastic Surgeons, and I'm going to answer some frequently asked questions about the Preservé breast augmentation technique. Good candidates for this technique are women who have never had a breast augmentation or women who have had breast lifts but no previous breast augmentations and want a very natural and modest increase in their breast size. Surprisingly, the Preservé technique is one of the least painful ways to have a breast augmentation. The type of anesthesia used is minimal, but local anesthesia is used very generously to reduce the amount of pain that patients experience intraoperatively and postoperatively. The Preservé technique is over the muscle. A standard over-the-muscle augmentation typically requires general anesthesia, and the techniques used disrupt some of the natural anatomy and ligamentous attachments of the breast. Cautery is often used with a traditional breast augmentation, and the nice thing about the Preservé technique is that cautery often is not used at all, which limits the amount of inflammation after surgery, and it also preserves, which is the name Preservé, some of the natural ligamentous attachments of the breast. The incision is underneath the breast in the inframammary crease, and it's a very small incision, typically 3 centimeters. All breast surgery can affect breastfeeding. However, the Preservé technique avoids disrupting milk ducts, and so there should be minimal or zero, hopefully, disruption to breastfeeding. Because the surgical technique requires so little disruption to the natural anatomy of the breast, the recovery is actually much shorter and quicker than a traditional breast augmentation. It's less painful, and patients can return to their regular activities much quicker than with a traditional breast augmentation. So the implants do settle a bit, but not as much as with a traditional over-the-muscle breast augmentation because of the preservation of ligamentous attachments of the breast. If you're interested in a Preservé breast augmentation, please call me and schedule a consultation.